Namaste. Hello. Good morning. I am Dr. Sunny Gugale. I am an orthopedic surgeon. I am a sports medicine specialist and a robotic joint replacement surgeon. I am here today to highlight you about the advantages and the merits of robotic joint replacement surgery. Robotic joint replacement surgery has been popular in recent times, and the most important part of it is to improve the lifetime survivorship of the knee replacement. Friends, many of the times I cannot communicate to you in details. So this video channel or this YouTube channel is the purpose of this channel is just to get in touch with you in more details. So for further detailed information on each and every aspects of bone and joint health, please subscribe to my YouTube channel and click on the bell icon for regular updates. There is a myth about robotic joint replacement surgery. The myth is that why is it necessary? When the humans or the surgeons have been doing the surgery for last so many years, then why there is a need for doing a robotic joint replacement surgery? Friends, if I ask a carpenter to cut a wooden block in a straight line, how many times it is possible that he is going to cut in a straight line without having any aids and tools? It may be possible because he is a skilled surgeon, so he may cut around 90 to 95% of times properly, but still that 3 to 4% of error can happen. And to minimize this error, we are using this advanced technology of robotic joint replacement surgery. This surgery, this technique, the robot assists the surgeon in taking decisions, in cutting the bone intraoperatively, and it is fully automatic robotic system which will cut the bone in a micromillimeter pattern. This will add to the proper fitting of the implant. This will add to long-term survivorship of the implant, and we don't have to handle the surrounding soft tissues many of the times when we're doing a robotic joint replacement surgery. Hence, it minimizes the pain that is perceived by the patient after the surgery. This robotic joint replacement surgery has definitely an added advantage that it is going to have personalized alignment. Whatever the patient's pre-injury or the pre-arthritic alignment is there, we can restore the same alignment because of the use of robots, and it definitely is an added tool in the surgeon's armamentarium to give the patients the maximum benefit. There is a myth about robotic joint replacement surgery, my dear friends, and people do ask me every time that if the robot is going to operate in the operating room, where are you going to be? Are you sitting at home or are you sitting in another room watching the surgery? I am here to tell you that this is not the situation. I myself operate the knee surgery, and the robot comes and assists me in taking the bone cuts. It will help me in pre-operative planning. It will help me to see how I have cut the bone and how is the leg alignment to be and how is the balancing of the knee joint is to be. So the robots definitely have an added advantage. It adds to the precision, it minimizes the pain, and it increases the long-term survivorship of the implant. One another myth that I want you to tell, that many of the times people feel whatever is an advanced technology is too expensive. My dear friend, I am here to tell you that this is definitely not that expensive. Yes, it does add to some additional cost of the trackers, the disposables that we use along with the robots, but this additional cost is definitely worthwhile to spend to improve the precision and the survivorship of your knee joint. Dear friends, if you have been advised a knee replacement surgery, or to be precise, a robotic knee replacement surgery, don't be afraid of it. Don't worry, we are here to solve all your questions and queries. If you have any doubts, any questions, any detailed information required, please put a message in the comment section. I will try to answer them, all of them, and get the benefit of the most for your near and dear ones. Thank you.